Okay, good morning, everyone. We're just going to wait a couple of minutes to let everyone in. Thank you. Okay, hello, everyone, and good morning. My name is Tarandy Panu, and I am the Strategic and EDI Plus A Communications Specialist at the Canada Excellence Research Chair in Health Equity and Community Wellbeing at TMU. Thank you for joining us today for our first Open Lab of the year. This open lab will feature Eunice Tunggal's work on technology-facilitated gender-based violence, focusing on women with disabilities, experiences, and practices of safety and well-being in South Africa. The session creates space for collaborative learning, critical reflection, and dialogue across disciplines, centering community-informed research and equity-driven approaches to knowledge production. Today's event is virtual, with some of our team gathered here on TMU and others joining us online from across Canada and beyond. Zoom captioning is provided. For those online, please select the CC button on your Zoom menu bar in order to see the captions. This session will be recorded and available on our website in the weeks to come. I will pass it over to Karen Soldatich, Canada Excellence Research Chair, to introduce our program and researcher. We will keep time for questions at the end of this session through the Q&A function at the bottom of your screen. Thank you. Over to you, Karen.
Thanks so much, Tarandy. So my name is Karen Soldatich, and I'm actually the Canada Excellence Research Chair in Health Equity and Community Wellbeing. The CERC Health Equity and Community Wellbeing team wishes to acknowledge the land that TMU operates from, which is located within the Dish with One Spoon territory. The Dish with One Spoon is a treaty between the Anishinaabe, the Mississaugas, and the Haudenosaunee, that bind them together to share the territory and protect the land. Subsequent Indigenous nations and peoples, Europeans, and all newcomers have been invited into this treaty in the spirit of peace, friendship, and respect. The CERC in Health Equity and Community Wellbeing's research network operations and practices depend on traditional Indigenous territories to provide us with physical space, sustenance, safety, and community, and we are grateful to live, work, and learn here. Together with advisory members and partners, our work is long-term and multi-generational in nature. We aim to advance disability justice and health equity through intersectional, community-engaged research grounded in accessibility, care, and lived experience. We acknowledge the need for research by, with, and for Indigenous peoples and commit to establishing meaningful relationships with Indigenous colleagues and partners to develop our understanding and support. Personally, as a visitor to this land coming from Australia, I recognise it is an honour for me to be here. In Australia, we pay our respects to elders past, present, and emerging. Here I continue to learn from Indigenous storytellers, leaders, and colleagues whose perspectives help me reflect on and expand my own journey at the intersections of decolonisation, disability, non-normativity, and systems change. Indigenous teachings remind us that our responsibilities are not only historical, but ongoing, calling us to act with care, reciprocity, and accountability in the present. In this spirit, I offer my respect, gratitude, and commitment to supporting relationships and practices that uphold Indigenous sovereignty, knowledge, and futures. And now a little bit about the CERC. We are a transformative research initiative that employs an engaged community partnership approach to expand our understanding, practice, and delivery of health outcomes for all members of our communities. Through collaboration with a network of healthcare institutions, service providers, and civil society organisations, the program aims for a paradigm shift, one that challenges a siloed, expert-driven approach to health and well-being and moves instead towards a community-engaged preventative model of well-being. Uniquely applying a critical disability lens, the research program aims to not only reduce health disparities that are inextricable from their social context, but to embed community knowledge into healthcare institutions, systems, and models of delivery. I would now like to pass over to Eunice Tunggal, our wonderful research associate who's agreed to open today's first open lab for the CERC in health and wellbeing, to present on her research. As mentioned before, please keep your questions for the end of the presentation. Thanks so much, and thanks so much, Eunice.
Hi, everyone. Thanks so much, Karen, and thank you, Tarandeep, for the introductions. Hello, everyone. My name is Eunice. I am a research associate with the CERC of Health Equity and Community Wellbeing. I am a woman with short brown hair, about shoulder length, glasses, and light skin. And I'm currently wearing a shirt covered in flowers, if that gives you kind of an idea of my personality. But today I'm just going to be chatting about the work that we've been doing around technology-facilitated gender-based violence in South Africa, particularly about the experiences of women with disabilities living in South Africa. And so I guess to get started, just to say that if there are any slides that have images that are not decorative, I will be describing them for you in the case that you require that. So just to get an overview of what we're going to be talking about today, we're going to be giving you a definition, some definitions that are key to this work, as well as a background to the work, an overview of the project and the methods that we undertook, preliminary findings, and then some knowledge dissemination outputs that we're in the process of producing, and then finally some conclusions and recommendations. So for context, this project is developed alongside our colleagues at Stellenbosch University in South Africa. Our main population of focus was women with disabilities living in South Africa. And so this is an international collaboration, but focusing on the population in South Africa. So just to get started, so what is technology-facilitated gender-based violence? So that's a big, long word. I'm going to be referring to it as TFGBV most likely throughout this presentation so that I can keep my word count down. But TFGBV is referring to any violent act that is committed, aggravated by, or amplified by using digital technology or other digital tools, and that results in harm. And so just to give you a bit of an idea of what that includes, TFGBV can be anything from cyberbullying all the way to the withholding of technology. And so I think when I say the words tech-facilitated gender-based violence, or when I kind of bring up that term, a lot of times that the first initial thought is probably cyberbullying, negative comments on your social media, for example, like a hate comment on Instagram, or maybe even unsolicited messages or images being sent back and forth. And so those are definitely forms of technology-facilitated gender-based violence. However, this definition is constantly evolving because there are unfortunately new ways that people are learning to use technology in order to violate people. TFGBV can occur through social media, as I've said before. It can occur through messaging apps by calling your phone, but it can also happen through means that we might not have seen in the previous 10 years. So things like geographic trackers, so using your Find My Friends app in order to locate you and control you or monitor where you're going. Things like being able to use AI in order to develop deep-faked images of you. And so there are so many different ways that technology is evolving in great ways, but unfortunately, because those same technology can be used for harm, oftentimes they are. In the context of disability and in context of women with disabilities, TFGBV can often be exacerbated, often due to the fact that women and people with disabilities have shown to have lower rates of digital literacy, may experience higher rates of intimate partner violence, which can also be a way that technology is used as a form of violence. So in terms of the importance of this work, I think we can think about there's so many ways that technology impacts our life today. And in fact, we're doing this session online right now, and it's going to be posted on the internet for people to see. And so technology is an incredible way of navigating society, an incredible way of participating in events, and participating in economy, in finances, in socialization and community, in developing your career, and creating businesses. Some people's businesses are entirely online, and forms of communication, entertainment, education, healthcare. And so technology is expanding in such beautiful ways that we're able to access all of these things. And so people with disabilities, in fact, often benefit highly from having access to technology because it doesn't require the physical element of certain parts of society anymore. So, for example, a doctor's appointment that might have been previously inaccessible or difficult to navigate to might be very easily accessed online. However, experiencing violence through technology is therefore more likely and has bigger consequences than ever before because we are spending so much time using technology and navigating online life. So in terms of our project, a bit of an overview is that 1 billion people, and more than that, live with disability worldwide, and about 20% of women live with a disability. And so that's a huge proportion of the population of women, and a huge number of people with disabilities. And women with disabilities are at a higher risk of experiencing TFGBV, as I said before. In South Africa, particularly, the experience of TFGBV is not very well documented, and especially for women with disabilities. And so oftentimes we'll see in the literature that there's a lot of studies in the global north. And so in countries like Canada or the US or the UK, a lot of times they have really, really high quality studies about technology facilitated violence or those types of things. But we see in the global south that this is not necessarily the case. And particularly at the intersections of gender and disability, these studies are missing. In order to address that gap, we decided to conduct a mixed method study over the course of the last year and a half, almost 2 years, in order to better understand the experiences of TFGBV for women with disabilities living in South Africa. And so just a quick overview of the methods. It's a very wordy slide, but I'll just kind of go over it very briefly. We started with a scoping review of the literature just to get an idea of what exists about women with disability and their experience of TFGBV. What we found actually is that there's not studies on gender disability in low middle income countries. Typically, there'll be studies on gender and TFGBV in low middle income countries, or there will be studies around disability and TFGBV in low middle income countries, but not necessarily looking at the intersection of those two things. And so we started with that scoping review to kind of inform what we saw and how we approached people about these questions that we had about TFGBV. The next thing we did is to develop a pilot survey. And so that was to develop a survey that would ask the questions around what are your experiences of TFGBV, what forms of disability do you have, and how have those impacted your experiences of TFGBV? So we did a lot of survey testing with key informants who were women with disabilities, our partners in South Africa, which we recruited through disability organizations and crisis centers. And so we were able to co-design that study and co-design that survey really nicely. And then we implemented the national survey. After doing that national survey, we also did some in-depth qualitative interviews to kind of triangulate the data that we found in our survey. And all of these last two methods were mainly recruiting women with disabilities across South Africa. And we tried to get a representative sample using our partners with disability organizations and gender-based violence organizations. So I'll go over some of the findings. I think we'll be making these slides available for people, and I would hope that maybe you can review it later because I know numbers a lot of times, so many numbers and so many words are hard to grasp onto. But I'll just kind of go over some of the main findings. First being that the most common disabilities that people reported who were reporting TFGBV were psychosocial disability, intellectual and learning disability, and pain-related. In terms of psychosocial disability, we didn't ask whether the disability had been acquired before or after the experience of TFGBV, so we are unsure of the relatedness of those two things, but those were the most common disabilities reported. The most commonly reported form of tech-facilitated gender-based violence was cyberbullying, and so that being harassing messages, comments on your social media, unwanted messaging, and repeated messaging. Next was image-based abuse. So we identified that as images that are unwanted being sent or your own images being shared without permission. We also saw hate speech and exploitation as very common forms of TFGBV reported. Higher rates of TFGBV were reported by women living in the Western Cape and Eastern Cape provinces, by African or Black and colored women. And those are the phrasing and terms that are used in South Africa, which is why I'm using those words. That's how they refer to different ethnic groups. And then higher rates of TFGBV were also reported by women with lower education levels or who are unemployed, and moreover by women who regularly receive social grants, meaning disability support, meaning they had lower income status. Overall, we also saw that TFGBV against women with disabilities is deeply intersectional. So not just at the intersection of gender and disability, but also at the intersection of those two things, as well as socioeconomic inequality, as well as LGBTQ status, as well as race. And so all of these things combine to create compounded risks and increase the prevalence of TFGBV or the experience of TFGBV. Women with disabilities also experience TFGBV, which often really specifically relates to their disability or their gender. And so, for example, when we're talking about tech-facilitated gender-based violence for people with disabilities, oftentimes we don't consider the fact that a lot of people with disabilities use technology in order to navigate life. So what we find is that people's disability has been used as a reason for people for others to control their devices without their permission, or to coerce them to give them access to their devices, or coerce them to be able to control where their devices are, how often they're being used, or to monitor where they are using those devices. And so disability adds this layer of extra structural and systemic vulnerability that allows women with disabilities to be more at risk for abuse. Something that we also saw was that women who were disability advocates on social media, and so by that I mean people who are posting about disability, who are advocating against gender-based violence, advocating for disability rights. These women often experience heightened levels of TFGBV, as we saw in our qualitative interviews. The majority of women that we that wanted to speak out and continue to talk about TFGBV wanted to do so, were disability advocates. TFGBV was also reported to be perpetrated by both strangers, which was expected, so people you don't know just randomly coming onto your social media and saying hateful things, but also by people who were known to survivors, so including partners, including friends, including coworkers, including family members who might say snippy comments or leave really rude comments on their social media. It's not just strangers, is what we kind of realized. And then finally, most participants did not report any of their experiences of TFGBV to law enforcement or to the platform. And so for the most part, we saw that people either didn't know that they were able to report, did not know how because it wasn't accessible to them, or they thought that the reporting would do little to support them, so a lack of trust in response. And so most commonly what we saw is that women with disabilities, the people that we talked to, instead of reporting, instead of doing these things that could help support them, what they did was withdraw from the use of technology or stop using technology altogether. I'll kind of talk about the data collection process a little bit because those were really, really relevant findings. But what we found is that we also had some barriers in collecting data. Digital data collection is difficult because of the digital divide in the population. And so women with disabilities in South Africa tend to be lower socioeconomic status, tend maybe not to have as consistent access to the internet, as consistent access to digital education. And because of that, there was a huge digital divide in the population. And we actually had to address that by providing the survey at community centers where they were able to take the survey with the support of others. Another thing that we encountered was fraudulent participants, which is a whole other conversation that I won't get into now. But digital data collection is fraught with fraudulence, as many of my researcher friends know. Another thing that we realized is that people have a limited understanding of technology-facilitated violence as actual violence. And so for a lot of people, it was just a commonplace thing, something that just happens. It wasn't actually considered to be something that was that could be dealt with. And that was a very big barrier in some low-income communities that we spoke to. And so what ended up happening is that our colleagues in South Africa, Babawa and Dee, were able to provide informational sessions and teach people about technology-facilitated violence and what it is, why it counts as violence, and what to do about it. And so these sessions were hosted to circumvent that issue of lack of knowing. So based on all of this, what are we doing with it? So at the CERC, we don't like to just publish for the sake of publishing. We like to publish for knowledge dissemination and for the community. And so on top of academic publications, which we are showing a graph of some of the findings that we found, but we're also going to be developing training modules and a textbook in order to provide a guide for women with disabilities who are survivors or people who have not yet experienced TFGBV, a guide for caregivers and family members of women with disabilities, and then a guide for service providers, to frontline service providers, so gender-based violence advocates to healthcare workers. This is a guide that will teach about how to identify, how to respond to, and how to protect against technology-facilitated gender-based violence. So those are currently under development, and I will be releasing that for people to be able to kind of provide comments on. This is a co-design process as well, I hope. So I'm writing this right now, and I will hopefully have that to you all, that people can review it and look at it. And I want comments and I want feedback on it. So I would appreciate that when the time comes. In terms of further recommendations, I just want to conclude with this slide that says that there's an urgent need for inclusive, intersectional, and survivor-centered approaches to address TFGBV. So we need more research foregrounding marginalized experiences, so including women with disabilities. As of right now, we're the only study that I know of occurring in low middle income countries for women with disabilities around TFGBV. And so we need to have more data on how to respond to that in low middle income countries. We also need more research on LGBTQIA plus contexts and people. Moreover, we need to co-design interventions against TFGBV that account for the engaged populations, that also account for digital literacy and social, cultural, and political realities. And then finally, we need to have coordinated efforts across digital policy. So not just us as academics saying things, but we need to be able to collaborate with our community partners and to bring it to the higher ups in government, to make policies that are able to protect women with disabilities and allow people to trust in law enforcement, and that bringing up issues of violence are actually going to get them somewhere. We need to make spaces, both physical and digital, safe for all women with disabilities. And I have a slide here about contacting us to see more of our work. But that's all for me. Thank you.
Thank you, Eunice. That was a wonderful presentation. I'm going to allow for a minute or two for folks to put in their questions in the chat box, and I will read them out loud.
Sounds good.
So I guess, Eunice, to start, what is your hope with this co-designed model with the textbooks and the resources for service providers, for disability organizations, and for folks who are caregivers? What is your hope that the takeaway from these resources will be?
That's a great question. I guess the hope is that all of these relevant engaged groups are going to be able to know how to protect their loved ones against TFGBV and to protect themselves against TFGBV. We ultimately want people to be first able to identify it and not just brush it off. Violence is violence. And so saying it and acknowledging it first off and knowing what it is ideally the first line of defense. We can't control what other people do. We can't, as much as we might want to change behaviors of other people, we ultimately want to be able to protect ourselves and to protect those we love. So, and also for service providers to be able to respond to violence of their clients. That's a big thing that a lot of service providers are unaware of as of right now is how to respond to online violence and online harassment and harms. And so, yeah, that would ultimately be the hope is information and safety. Yeah.
Okay, we have a question from the room. So just
Eunice, thank you for the presentation. And I was wondering, I know this study is about South Africa, but based on your review of the literature on Global North and this work, do you see any differences in terms of the prevalence of TFGBV or any differences of forms of TFGBV between Global South and Global North?
Thanks for the question. In terms of differences, so our scoping review was on low and middle income countries. And so I don't have a huge amount of like context for Global North other than knowing that there's a lot of research out there. I think the main thing that I can comment on is that the difference between low middle income countries, high income countries. So for those who don't know, a lot of times we refer to high income countries, global north, global south as low middle income countries. Um, I guess we prefer global north and global south now. But in terms of the difference between, I'll say the difference between high income countries, and low middle income countries is that the types of platforms that are used is very different. And so we found in South Africa a lot of the time, Facebook is a really common platform that violence is experienced on because Facebook has plans that include data. And so most people in South Africa might not have Wi-Fi at home, but they use their mobile data for the most part. And they'll only have access to Wi-Fi maybe at work or school. And so the platforms that they use are shaped by that. And so oftentimes they will be using data, mobile data, and apps that allow them to use mobile data. That'll be like Facebook is a very common one. What we did find is that higher income participants in our study, and I think this might be reflective of the Global North as well, is gaming, and where people experience violence on gaming apps and streaming platforms as well. That's a lot more prevalent for higher income groups. And so we might see that in the Global North. But to make direct comparisons based on literature, I only have context for low middle income countries. So, yeah.
Thank you, Eunice. We are at time, so again, I'd like to thank Eunice for her wonderful presentation and the CERC in Health Equity and Community Wellbeing team, as well as everyone attending online. Please make sure to check out our website for information on today's and future events, news, opportunities, and our Knowledge Mobilization Hub. Our next open lab will be the first Tuesday of next month, so that will be April 7th at 10:15. Please scan the screen to register for the event or visit our website, torontomu.ca/CERC-health-equity to sign up. Thank you.